I'm Senator Nancy Spence. I'm a state senator from District 27, Arapahoe County in Colorado. It doesn't feel good to be asked to be here today to address the issue of women and children in poverty in Colorado, and to realize that the number of women and children, particularly children in poverty, is on the increase. In the last 10 years, it's increased so that now there are several 100,000 youngsters living in poverty in our state. Statistics from the Colorado Children's Campaign state that Colorado has the fastest growing rate of women and children in poverty in the nation. Poverty, low wages, lack of health care insurance affect far too many women and children in our state. Colorado needs a strong, basic safety net for women who are struggling every day just to put food on the table and to pay their daily bills. Those of us who are in elected office need to pay attention to these statistics and do everything that we possibly can to offer support, opportunity, and solutions to Colorado's women and children. I thought I would focus on three issues that I wanted to talk about, issues that seriously affect women and children in poverty. One is jobs. The second one is education of both the mom and the children. And then third, the issue of health care, accessible, affordable health care for women and children who are living in poverty. So let's start with jobs. Too many of our young women are dropping out of school, many of them pregnant, without completing their even a basic high school education. When women leave high school and have babies, and when they're not married, they're doomed to sometimes a lifetime of poverty, and so are their children. A high school girl who drops out of school will struggle to get a job that pays enough for the basic necessities, much less an opportunity to build a future for herself and for her children. A high school diploma isn't even enough these days. A young woman needs to stay in school. Now Colorado offers opportunities for women and young men to get concurrent enrollment. That means they can be enrolled in a high school course. While they're getting their high school diploma, they can also be working toward a 2-year associate's degree that will prepare them to enter the workforce when they graduate from high school with a high school diploma and a diploma that will allow them to go into the workforce and get a pretty good paying job. This is called early college. Some call it concurrent enrollment. Some call it dual enrollment, but every high school student needs to take a look at what they can do to graduate with these 2 degrees. Then let's talk about the education of their children. For women in poverty, the first thing they need to do is look for quality public schools to put their children in. It might be that the school on the corner, but it might not be. Women in poverty need to take a look at what school best fits their needs. Is it a charter school? Is it an innovative school? Is it a magnet program? All these opportunities are available if the moms know how to access information to put their children in a good quality program. And further, these schools need to put the highest qualified teachers, our very best teachers, in the most struggling classrooms. We can't continue to put our least proficient teachers with the students who are struggling the most. Colorado needs more high-quality daycare, childcare, and they need high-quality preschools. We can't overestimate the importance of giving kids a good head start by putting them in early childhood and good daycare programs. So when they start kindergarten, they're ready to learn. So when they start kindergarten, they have a vocabulary that's comparable to the kind of vocabulary that the kids in middle income and upper income families have. And particularly, there needs to be a focus on English language learning. Too many of particularly our Latino kids enter public school public preschool not having a grasp at all of the English language. That really holds them back. There needs to be an opportunity for moms to learn English as well as their children to learn English as well. Schools need access to federal programs that will provide a breakfast and a hot lunch for kids who are in poverty. Kids can't go to school when they're hungry and expect that they're going to learn. It's such an important aspect of student learning that they have their little tummies full, that we provide access to programs that make certain that they're well fed, both at breakfast and at lunch. And that's a program that we can continue to support in Colorado. Support for kids with special needs is important. There are hundreds and hundreds of kids that have been identified as students entering school with special needs, whether they're dyslexic, whether they have multiple handicaps. But we need to pay attention to those kids with special needs and put additional resources into the education of these very special kids. Now let me move on to health care. My focus has been that every child should be covered with basic health care by the year 2010. We've been working toward that by providing additional access points for low-income families to access the enrollment applications in order to get enrolled in CHIP, the Children's Basic Health Care Program. Too many parents aren't even aware of that program, and they don't know where to ask. The access points need to be at schools, they need to be at churches, they need to be at community centers to make certain that those who are eligible for Medicaid and for the CHIP program have an opportunity to enroll, and then further to re-enroll after the first year, either on the telephone or on the internet, to make certain that there aren't those gaps in coverage between when a family, a parent and child first becomes eligible, and then when they lose that eligibility, possibly after the first year. Every child needs a medical home. That means that health services are coordinated to cover all spectrums, everything from immunizations to basic health care to emergency care. Every child needs a medical home. So to end, I'd like to just say that with rising unemployment, with increasing costs of food and fuel, gas and utilities, the opportunity to access solid basic health care, Colorado needs to offer a hand up to women and children in poverty, a hand up to make certain that they're given access to the basic care. It's just the decent thing to do.